Hello everyone, and a very good morning from Lahore, Pakistan. And as I am discussing mechanical injuries, and on mechanical injury, this is the 8th lecture. And in mechanical injuries, we have started discussion on the contusion. And this is second lecture on contusion. And today the learning objective will be that I will be discussing the factors which are responsible for change in appearance of contusion. And these factors are the age factor, age of the individual, that is young one or old one or middle-aged. Then the sex factor, because the sex of the individual plays an important role. The type of tissue, that the area involved, that underneath is hard bone, soft bone. Similarly, the vascularity of the area. The area is high in vascularity or low in vascularity, so this is also an important factor. Then the color of the skin. The person is fair colored or of dark complexion, so this will be responsible change in the visibility or the appearance of the contusion. Then the natural disease. Some natural disease, systemic disease regarding the blood clotting or thrombocytopenia or any other disease which will be changing the appearance regarding the hemorrhage, the clotting factor, the hemorrhagic factor. So any natural disease will be responsible in causing the change in the appearance. So now we head towards the lecture. Take care. Dr. Javed Iqbal Khokhar, Professor of Forensic Medicine and Toxicology. We are discussing mechanical injuries, and this is lecture number 8 on mechanical injuries, and we are discussing the contusion. These are the injuries which are caused by blunt weapons. And this is the second lecture on contusion. And in this lecture, I will be discussing the factors which are responsible for change in appearance of the bruise or contusion. And these factors are the age factor of the individual, the sex of the individual, the type of tissue involved, and vascularity of the area. Color of the skin, that the person is fair colored or of dark complexion, and if having some natural disease, and that disease may be either of the blood vessels or the blood clotting or any other general disease which interfere with the clotting or the hemorrhagic phenomena. So regarding the age, as we very well know that the infants and the children, because of the tenderness of their tissues, they bruise easily as compared to adults. And similarly, the old persons, old individual, as they are having less fat and flesh, they bruise also easily as the infants. So the sex factor is also important because we know that the female having more soft tissues and fat as compared to males. And as in the soft tissues, there is vascularization is more. So they are more vulnerable to bruise. So the females as compared to males having soft tissues in tender soft tissues, they bruise easily as compared to males. Regarding the target of the tissue, the area where the blunt force is being applied, that is underneath there is hard bone, or it is a hollow viscera, or the soft bone, or the skin is tightly attached. So the areas where the skin is tightly attached to the deep tissues like palms and the sole, the appearance of bruise will not be as prominent as other areas. That is the palm and the sole area, when they are applied the blunt force, they bruise, but the appearance will not be visible. They are very tender, very painful as compared to the other areas. Whereas in the areas where the skin is loose and lax, the bruise appear easily and they are prominent. Sometimes the extravasated blood may travel along the tissue lines and settle in those loose and lax areas. For example, in the fracture neck of femur, which is a much deeper structure, the bruise appear on the lateral aspect of the thigh. That is called also ectopic bruising. That the area of fracture is deep, but the appearance of bruise is on the lateral aspect of the thigh. Then the vascularity of the area. The areas which are more vascular, they will bleed more easily and hence the bruise will appear easily. Regarding the color of the skin, in fair colored person, the bruises become visible easily as compared to the person which are having dark complexion. Then the natural diseases, as I talked earlier, that some natural diseases of the blood or the blood vessels, they bruise easily. The persons having thrombocytopenia, persons having fragile blood vessels, or any other natural disease which is affecting the systemic system of bleeding or clotting, that those individuals will bruise easily as compared to healthy individuals. So thank you very much. This is all about the lecture number 2 on the contusion. If you like my videos, please subscribe to my channel. And my channel name is Dr. Javed. Thank you very much.